Good morning, Miss Corinne. How are you today?
Good, how are you?
I'm fine, thank you. Today I'm going to be transferring you out of bed to the wheelchair. Okay? How are you doing?
I'm good.
Good. My name is Angela. But before I do, let me go provide privacy, wash my hands, and gather my equipment. Okay? All right. So I close the door for privacy. I wash my hands. In COVID world, they want you to wash your hands with the hand sanitizer. And now I'm going to put on my gloves. Good. And I'm going to gather my gait belt. And here's my wheelchair facing the head of the bed. Very important. This is one of the most critical steps. I'm going to lock the wheelchair. 1, 2, and I'm going to move the pedals out of the way. See, I just lift them up out of the way. I can take them off too, like this, but I prefer just to lift them out of the way. I'm also going to make sure that the bed wheels are locked. 1, 2, and I'm going to bring this closer to you too. Close to you, okay? Now, if you come here. Good. I'm going to lower the bed so that your feet are on the floor, and I'm going to ask you, are those your non-skid shoes?
Yes.
Yes, so you have your non-skid shoes, and the bed is lowered to where your feet are on the floor. Okay, very important. Those are the critical steps. Wheelchair lock and feet flat on the floor. Now I have to give you instructions before getting you up. So I'm going to say, Miss Corinne, I'm going to use the gait belt to get you up, but I'm going to count to 3. On the count of 3, I want to assist you. I want you to help me get up. Okay? All right. So now I'm going to go ahead and put on my gait belt. If you would raise your arms. Good. You can put them down now. And then I'm going to put this one in first. I call it feed the teeth first. Put it by where the teeth are at first. And I say pull it back. Pull it back a little bit. 2 fingers are able to get in. And feed the tail. So you feed the teeth first and then the tail, okay? Now your hands should go inside here. Okay? Not yours,
okay.
My hands.
Yes. Okay.
My hands will go there. Also, I'm going to put toe to toe, knee to knee. Okay? Now, on the count of 3, remember? 1, 2, 3. Now I'm going to have you come on over to the chair, line up, and let you sit with your buttocks way to the back. And I always say, since I'm by the belt, stay with the belt. So I'm going to go ahead and take off the belt now. I'm going to ask you to lean forward so I can take out the belt. So you don't tug the belt out, okay? You lean patiently forward and take it out. Now you're going to have the client put their feet back on the pedals. 1, 2, make sure your patient is comfortable. I'm going to rest this here. And I'm going to open up the wheels so that I can bring you closer to your call light. And I'm going to say, here is your call light. Call me if you need to. I'm going to make sure you're comfortable. Are you comfortable?
Okay. If I'm rolling, yes, I'm comfortable.
Good. I don't want to necessarily lock your chair. You don't have to lock the chair.
You don't need to lock it.
No, you don't have to. But you can make sure your patient is comfortable. Give her her call light. I'm going to take my gait belt away. Thank you very much. I'm going to, don't take my hand. I'm going to take off my gloves, trash them, wash my hands, and I'm going to say to the evaluator, I'm finished with that skill.